Hi everyone, thanks for joining us here today for the Breastfeeding Peer Counselor training. It's been a long time since we've been able to do this, so I appreciate everybody taking time out of their day to join us. So I'm going to get started. My name's Erin Johnson. I'm the WIC Nutrition Consultant and Breastfeeding Peer Counselor Coordinator for the state of Colorado, and I'll be presenting Helping Moms When Things Don't Go As Planned. And I'm joined today by Sonia Lindsay Kreitz, who is the Breastfeeding Peer Counselor Coordinator in Pueblo, and she's also an IBCLC, and she currently is administering our Breastfeeding Peer Counseling Pilot Texting Program. And she's going to talk today about how to talk about breastfeeding when mom wants to talk about formula. And we're also joined today by Maria Torres and Elena Hughes, who are peer counselors from the Breastfeeding Peer Counselor Tri-County Health Department. And they will be presenting how to support a breastfeeding mom when those in her life do not support breastfeeding. So with that said, I'll get started. I'm going to be presenting Module 8 from the Loving Support Platform. Again, helping moms when things don't go as planned. And I won't be presenting the entire module as it's quite long, so I've picked out some of the main concerns that moms deal with. And occasionally things don't go as planned. We all know that, right? So the best intervention as peer counselors or any other WIC support staff is early intervention. Breastfeeding is not usually about problems, especially when moms are prepared, well educated, and have really good support. Our roles as peer counselors are to support the mom when breastfeeding concerns arise and to affirm her decision to breastfeed. So 3 important rules I'd like everybody to remember are: 1, as peer counselors, we need mom to feed the baby, especially while she's working through concerns or issues. Number 2, we need her to protect her milk production. And 3, seek a solution. So please remember those 3 rules when you're going about counseling a mom.
So be observant that there are possibilities when you're going to have to refer out. Not to say you're not all breastfeeding experts, and some of you are IBCLCs, but with WIC protocol, we sometimes need to refer the mom to the high-risk counselor or the breastfeeding expert in the clinic or the community. But your continued support while she sees the breastfeeding expert is critical. Mom-to-mom support has been shown evidence-based to really support the growth and time that moms actually breastfeed. We need to provide encouragement, support, and affirmation. And affirmation is powerful when mom is having problems. It can actually help release oxytocin, and that can help moms relax. And when moms are relaxed, they're more prone to accomplishing goals and setting goals than when she's stressed out. So let's get started. So today I'm going to talk about some physical concerns on mothers and with breastfeeding, and then some emotional concerns. In lieu of time, I'm not able to complete the entire module, and they actually recommend it not all be completed in one training since it is a lot of information. So I've chosen some of the top topics that moms typically are concerned about and that peer counselors encounter. So one of the top topics is sore nipples. And I would say most moms, great picture, right? Most moms prenatally, when you ask them what have they heard about breastfeeding, or do they have any concerns, they may say they're worried about their nipples and that they've heard that they're going to crack, they're going to bleed, they might fall off. You hear the extreme versions. And or mom may have had this experience with a prior baby and wasn't able to get help and fix the problem with the solution. So sore nipples is extremely common. We want to educate moms that mild discomfort can be normal, but pain is not. So if it's painful, we need to fix the problem. And we need mom to know that there's solutions out there. So when you're talking to mom, ideally you're seeing her in person, but a lot of times we're doing this over the phone or maybe initially over texting. We want to find out, is this one nipple or is this 2 nipples? Is this a cracked or bleeding nipple? Is this just a slightly red nipple? So kind of the status of her nipples, and and how sore they are, and that will lead us to if we need to refer the mom to the high-risk counselor or not. And some typical causes would be the baby is not positioned properly, obviously easier to see if you see the mom in person, but making sure the baby is on the breast correctly and not nipple feeding, that the baby is breastfeeding with a mouth that is wide open. And also when baby is being switched from breast to breast, or a mom's trying to relatch the baby, to not just break the suction without putting her finger in the baby's mouth to gently break the suction, so she's not popping baby off the breast. Baby may have had other nipples, so bottles or pacifiers. Going too long in between feedings, so baby's sucking vigorously. Possibly has a fungal infection, and mom's nursing pads are wet. She may not be changing them often enough. Mother might be using the breast pump improperly or the wrong size flanges. Raynaud syndrome, which is the painful blanching of the nipples. Uh-oh, my screen just went. Oh, sorry. Okay, sorry. Also, oral problems could occur. And then the baby may have a tongue tie and other oral abnormalities. Mom may be using perfumes or lotions that are irritating the breast as well. So what does mom need to hear from us? She needs to hear that this will get better and that there are solutions to these issues. And then we want to talk, of course, about the solutions to the problems. And we want to encourage mom to use clean breast pads that are dry and not continually using the wet ones. Encourage her to breastfeed on the side that's least sore first. Try different positions. Possibly using a bag of frozen peas with a wet washcloth and or wet or cold cabbage leaves in the bra tends to work as well. Massaging the breast prior to feeding to have the milk ejection let down begin. And do not limit how long the baby breastfeeds. And afterwards, applying breast milk to the nipples and letting them air dry. This one's a little controversial. You'll hear some say yay to this and some say nay to this one because it could increase the risk of infection if mom's hands aren't clean, etc., and she has a cracked or bleeding nipple. Applying lanolin if the skin is cracked or damaged, and avoiding creams that must be removed. And of course, if mother says her baby has white patches in his or her mouth, then we definitely need to refer because that's a sign of thrush. And when you see this yield sign during this presentation, that just means we need to provide the solutions for mom and then also yield and refer her to the high-risk counselor. Using breast shells, of course, would be helpful in between feedings. Also, if her breasts are extremely sore, pumping until her nipples heal is another option as well. So the next thing we're going to talk about is when a baby won't latch. And obviously this can happen with a newborn. This can happen 6 months down the road with refusal to nurse, etc. Now this is just a picture. It doesn't have PowerPoint slides to go with this. So I'll just be talking throughout this topic. So the difficulty latching onto the mother's breast may be due to flat or inverted nipples, breast engorgement, incorrect positioning, tongue tie, oral abnormalities, or breastfeeding technique that needs fixing. Early exposure to bottle feedings can also cause some nipple confusion, potentially, and or difficulty attaching to the breast and effectively extracting that milk. So with a baby who's not latching, we need rapid response, and that's crucial so the baby doesn't get into trouble. Baby needs to be seen and evaluated by a healthcare professional or the healthcare provider, and then also the high-risk counselor. But we want to make sure baby's getting nourished and not losing weight. So suggestions in between the mom and the baby seeing the healthcare provider and or the high-risk counselor is not waiting too long in between feeding. So if she's going every 3 hours, every 2 hours would be recommended. Expressing milk and feeding the baby in a dropper or with a spoon or a bottle if it's been introduced. Skin-to-skin contact as much as possible, especially before feeding. Trying to feed the baby before the baby is fully awake may help. And at the end of the day, we need to feed the baby. So however that occurs until mom gets help is important. So you may have a mom who does not want to use a bottle but is able to express her breast milk. So if the baby's not taking it through the dropper or the spoon, you may have to encourage the bottle until the mom gets help, because we don't need to end up with a baby who's not nourished. And we need to provide the mom reassurance and praise for her hard work. This is an extremely trying time, but again, reminding her solution and help are on the way. The next subject we're going to talk about is engorgement. And yeah, that's engorgement. These pictures are awesome. You know, engorgement is near and dear to my heart. That was my huge problem when I was breastfeeding, and I tried every trick of the trade to not let this occur, and it still occurred. So, you know, my thought process is as much as you can prenatally to educate the mom on this could occur within the first 2 to 5 days postpartum, and, you know, to prevent it from occurring, giving her the tips, frequent feedings, etc. But also, if it occurs, giving her some solutions, just so she might have that in the back of her mind if she starts to notice that engorgement is happening. Engorgement is a really tricky situation. You can have mild engorgement, you can have severe engorgement. Severely engorged moms do need to be referred and be seen, because this can cause a domino effect. And, you know, the domino effect is if the breasts are not relieved of the breast milk, baby can get less milk, milk ducts can become plugged, milk production can slow down, and the mom may wean prematurely. So, again, rapid response is crucial if mom is severely engorged. And typical causes for engorgement are, you know, missed or delayed feeding, so not feeding every 2 to 3 hours, you know, initially. Baby's too sleepy to feed at night, which mom might think is a great thing, but at the end of the day, it's not going to be so great for her breast. Mom's busy and overlooks feeding, especially a mom with several kids. Baby's pacified, so feedings are held off. Baby's not getting hunger signs. Mom may have received IV fluids in the hospital, which can increase the risk of engorgement. And then the baby's not latched well enough to remove breast milk. You know, and another cause I'm going to put on here is late milk onset. So milk coming in late, around 4 days postpartum, can tend to increase the risk of engorgement. That is what I experienced just on a personal note, and, you know, all the signs of my son not getting enough nutrition were there, the decreased diapers, etc. But thank God for that 2-day checkup when, you know, I found out he was extremely jaundiced and had to go to the NICU for a couple of days. So, you know, you can still follow all the tips and recommendations, but, you know, a mom who's severely engorged definitely needs to be followed up with to make sure no one gets into trouble. So some solutions. Well, a mom needs to hear that this will get better and that you can help her with some comfort solutions in the meantime. So massaging the breasts prior to feeding to soften them up. Warm showers are always recommended. Expressing some of the breast milk out prior to trying to latch the baby on, and that could either be with hand expression and or pumping. And applying a warm, wet washcloth or a compress. And another idea also is to get a small baby diaper and soak it in warm water and put that on your breast. because it cups it nicely. And again, hand expressing. And there are some videos on here too, so if anybody's interested in getting these videos, I can give you the info to connect with that. After breastfeeding, ice packs can help relieve swelling. I do like the cabbage leaves as well, as they cup the breast nicely. You just have to change them often. Frozen peas, ibuprofen, if your doctor says that's okay, which it should be. And pumping after your feeding is definitely important to empty the breast. And also find out how often mom is emptying her breast or breastfeeding. If it's every 3 to 4 hours, you might want to encourage every 2 to 3 initially, just to get that milk out. And again, refer as needed, especially if she's severely engorged. And then the next question, or the next subject we're going to talk about is milk production worry versus true low milk production. So this is just a slide. It doesn't have any PowerPoints, but the low milk production does. So I would say most moms think they don't have enough milk because they can't see how much the baby's getting unless they're expressing and feeding from a bottle. So this was something I heard all the time. I don't think I'm making enough milk. So certainly prenatally educating her on signs that she is making or will be making enough milk, and follow up that postpartum, again, signs that she's making enough milk. And so, it's encouraging to have her keep a breastfeeding log, if she's worried about her milk production, where she can record the number of bowel movements a day and recommend aiming for 3 or more is a good sign that first month or so. 6 or more wet diapers a day is a positive sign. Gaining 4 to 7 ounces a week, and we know she's going to be seeing the pediatrician pretty frequently the first few weeks. And, oops, someone's might need to mute their phone, sorry. And also breastfeeding every 8 to 12 hours within a 24-hour period. So if mom records this and sees this, she might feel better about her actual milk production. So we need to decide, is this low milk production or just a worry? Because low milk production does happen. And we need to figure out if that's really the case. So if you're talking to mom to try to assess this, you can certainly ask her, has the baby had a weight check recently, and how's the baby's weight gain? Obviously, if the baby's not gaining or losing, then that's a concern. And could be a sign of true low milk production. Ask her about the number of wet and dirty diapers per day. So if baby's having inadequate stooling or less than 6 wet diapers a day, again, could be low milk production. How long and how often does the baby feed? If it's infrequently and the feeds are short, that also could be a sign, and we may need to refer. Ask ask mom what else she's feeding the baby. Is she supplementing, and how often is she supplementing? If it's 50-50, half breast milk, half formula, that's probably an indicator that her milk supply is a little bit low. And do the breasts feel fuller before breastfeeding? And if not, that could also be a concern. So again, causes could be supplementation, not feeding 8 to 12 times a day, mom delaying or missing her feedings. Other concerns might be a history of breast surgery. Mom could be pregnant again, and that may decrease milk production. She could be on a birth control method that is not compatible with breastfeeding. That could affect the milk supply, especially the early weeks. Antihistamines and other medical conditions may exist that are causing this. So what does mom need to hear? She needs to hear what a great mom you are for being worried about this and letting us know. But we also need to remind her that if you have milk, you have options. So if she still has milk in her breast, we have options to try to increase that milk supply. So we need to provide solutions. First, if it is true, low milk production, we definitely need to refer her so the baby is getting nourished. We need to recommend increased the number of feedings and the durations of the feedings. If she's at 6 feedings a day, see if we can't get her to 10 feedings a day. And also after feedings, it's probably not going to happen every time, but having her pump after feedings too to fully empty the breast. Encourage skin-to-skin contact to increase oxytocin levels. And breast compression while she's feeding so the baby can get more fatty parts of the milk. And there's this video here as well that you guys can refer to on that. And expressing the milk again with the breast pump or hand expression afterwards to empty the breast. And to gradually wean the baby off supplements while building milk production and not to obviously abruptly stop that. So I think when moms find out their solutions, they get very relieved and they know they're being monitored, they know they have support and help through the pediatrician and through the peer counselors and the breastfeeding experts. So it's definitely a fixable situation. And the next part I'll talk about, I'm running a little short on time here, but I was going to talk about the emotional concerns that moms have postpartum. And I'm sure we all experience some of these, one or two at least, I'm sure. But, you know, when you speak with a mom postpartum, I would say the first thing you need to ask is, how did your birth experience go? You know, she may have had a really bad birth experience. She may have wanted a vaginal birth and ended up with a C-section, which for some people, that's okay. They just wanted a healthy baby. For other moms, that was a loss of the idea that they had of having, you know, this certain birth experience. So they could be mourning that. Also, they may have had a preterm delivery and the baby's possibly in the NICU and there could be medical problems there, so that's inhibiting them from having that maybe normal, typical breastfeeding experience that they envisioned. Mom herself may have had some postpartum complications, which again is maybe impacting the breastfeeding experience as well. So ask her, how did that go? How is she feeling? And with that said, all moms really probably experience lack of sleep, and we probably are still experiencing it several years later. So this is the trickiest one because I know I'm preaching to the choir here. There's not a ton of solutions to help a mom when there's lack of sleep. There's suggestions, and it just takes motivating mom to input these suggestions into her life. Labor and delivery is going to leave her exhausted. If she had a C-section, she's definitely going to be exhausted. Babies need to be fed frequently, so she's, of course, not going to get a full night of sleep anytime soon. And so we need to offer some strategies. So, of course, we always know we recommend sleep when the baby sleeps, but for some moms, that's just not possible, but it's still a recommendation. You know, if they like to go to bed at 10 at night, but the baby goes down at 8, maybe at least they can go down at 8. You know, maybe they won't nap during the day with the baby, but maybe they can go to bed earlier at night. Resist doing too much. Obviously, the dishes can wait, and house chores that they like to do, that can wait if they can resist doing it. And then also visitors. This is when visitors come by all the time. So putting limits on how many people are visiting per day, how long they're staying. If mom can do that, that'd be important. And accepting offers of help. So a lot of moms don't want to accept offers of help, but remind her that this is temporary. She'll get through it. She's not always going to need that extra help. And remind her that lactation hormones can give her an extra 45 minutes of sleep a night. So that's a fact. I don't know if any mom necessarily feels that, but we certainly can remind her about that. And then feeling overwhelmed, that of course is super common with all moms, I would say every day, right? Common in the early days, and your lactation hormones can contribute to this, your birth recovery, and the lack of support in your life. So this is a pretty common theme for some moms. And then if you have a fussy baby on top of that, that can be really challenging. So just reassuring her that her feelings are normal. I usually like to recommend to moms, you know, this first month, especially postpartum, is extremely challenging, and you're adjusting to a totally new schedule. So if we can make it through this first month, things are going to feel more normal, more routine. And again, having her accept the offers of help that are being offered, and not scheduling too many activities outside of just being a mom and adjusting to her new role, if she's able to do that, and if she has a support system that allows her to do that. And also, breastfeeding is a new skill, so it's like riding a bike. It takes time. So definitely, I felt like the first month for most moms is extremely challenging, and once they're about a month in, it feels more normal. So reminding her, take it one day at a time, 1 hour at a time, but things will normalize eventually. And just the last subject I'm going to talk about before I hand off my presentation to Sonia is baby blues and postpartum depression. Baby blues are extremely common, and the first 2 weeks of life, their hormones are trying to get back in balance. So this is normal, and you may see mom during the first 2 weeks, and she may complain of signs or symptoms of baby blues. So you can let her know, the first 2 weeks or so, this is fairly normal, and that most moms experience that. But if this is lasting beyond 2 weeks and the symptoms are worsening or persisting, that could be a sign of postpartum depression. And so also maybe discussing some signs and symptoms with mom of what that would look like. And ideally, all WIC agencies are going to have resources available. So if mom is showing signs or symptoms of postpartum depression, you can refer the mom to either support groups, their healthcare providers, especially if they had a history of depression, or are really struggling. Some Medicaid accepting counselors or private insurance counselors if they're on private insurance. And then also they have low-income sliding scale counselors that your agency may have a resource list for. So definitely knowing what's available in the community for mom if she's struggling. And then also postpartum depression can crop up anytime within that first year after having babies. So she may be having a great first 4 months, and then 4 months in, 6 months in, she's not feeling great emotionally and is exhibiting signs of postpartum depression. So that can occur too, and that's just something to be aware of. You may not be following mom, but you know what? She probably has called many of you 6 months, 7 months down the road because you've established that connection and that rapport with her. So you actually may be the first person she calls if she's struggling. So hopefully all agencies have those resources available that you can then refer mom to. So that is what I'm presenting on the Module 8 today. I know it's a lot of info. I know for a lot of you this is a review because you're pretty seasoned peer counselors. We have some that have been with the program since the beginning. We have some that are newer. So I appreciate you joining the webinar. And sorry for the snafu in the beginning with the video clip. That didn't happen when we did a test run, so I apologize for that. But I can certainly send out a link for everybody if they'd like to view that if they haven't yet seen that. And so at this point, I'm going to hand off the presentation to Sonia. Hi everyone, I'm Sonia, and I'm going to figure out what I need to hit here. You're getting it? Okay. So today's presentation is on the F word, and some of you may have heard the F word training before. I've done it for a couple of different trainings, and so we'll get started here in just a second. Okay, so the F word training. So what is the F word? Well, we're talking about a mom who's talking about giving formula. What do we do as peer counselors? So one, we want to acknowledge her concerns. We really need to, make sure they understand. We do hear what they're saying. We need to talk about how she knows her baby's getting enough. How to make sure her breastfeeding practices support exclusive breastfeeding. So that mom may feel like she is doing everything correctly, but maybe she's going
from the end of the feeding to start of the feeding, which makes it more like 4 hours instead of every 2 to 3. What is the real reason she wants to give formula? Sometimes we have to really stop talking and start listening to make sure that we understand what her real reason is. We're going to talk about that in a little bit of detail in a minute. What makes her think she needs to give formula? Maybe she's from a family that does formula feeding, and everyone says, well, your baby's feeding all the time. What is you're starving your baby, and everyone is saying give formula. She gives a bottle of formula, and the baby sleeps. Oh, maybe they're right. So we really have to find out why she thinks this. Has she tried pumping and to express and give it in a bottle versus giving formula? Okay. Why does the mom feel she needs formula? Well, we need to ask the right questions to get the right info. So you might say, can you tell me more about why you feel you need to give formula? Or maybe, tell me what your baby's doing that makes you think he or she needs formula. What are some common reasons a mom may want to use formula? So a lot of it is going back to work or school. Some of it is perceived low milk supply, and Erin touched on that. That's usually the number one reason we have a lot of moms start supplementing. Pressure from family, maybe others want to feed the baby, or too busy. I'm too busy to stop and sit down with my baby. Lactation complications do play a role, and breast refusal is a really big one, but is fixable with the right help in most cases. Oh, and don't forget that just in case can of formula. We want to make sure that they have that just in case. That's something I used to hear a lot before we started training on this. So first, when we return to work. So we need to find out a little bit of information. When does she go back to work? And how many days and hours will she be working? Maybe she's a mom who works 3 14-hour shifts in a row. Might be a little complicated for pumping and storing enough milk. Maybe mom's employer won't let her pump. How often, and we all know there's laws, right? But how often is she going to get the breaks to pump? And does she have a good quality pump? I find that to be one of the biggest problems, is that they get a pump that doesn't meet the full-time pumping need. It works for 2 weeks and then it stops working, or it may create problems. So I do find that to be a big problem with moms going back to work. So perceived or low milk supply, and so this little toddler wasn't getting enough from mom, so he just went straight to the cow. So I thought that was cool. Why does she think her supply is low? So we have to ask her, what makes her think her supply is low? What signs from the baby does she notice that tell her baby's not getting enough? So is the baby fussy after feedings? Is the baby not gaining weight? Maybe there's a true situation already happening. Has she started any medications that may affect her supply? My biggest rule with any mom is I tell them you need to ask 2 questions anytime you take a medication. How will the medication affect my milk supply, and how will it affect my baby? So when they talk to their physicians and they're getting medicine, that's what they need to be asking. And we need to make sure we're referring so that they get good, correct information if they're just getting it, say, from their cousin or sister or mom. Is she frequently completely emptying the breast? So she may have a baby who's feeding 5 to 7 minutes from the beginning. And so the baby's not been building the supply and not been emptying the milk, and so the breast is not making enough anymore. And if it does sound like a true milk supply issue, it's refer ASAP. Really important to make sure that we get that mom in there for help, because we want to make sure that there are no issues, and if there is, that maybe we can help fix that. Okay, so pressure from family. How would you like to be the mom sitting on this couch in the middle of everybody's formula feeding? Would that make you comfortable? I have a lot of moms who get asked, well, when are you going to stop that? I want to help feed the baby. I'm tired of looking at your breast. That's all you do is breastfeed. It's embarrassing. Every time I have family over, you're sitting there breastfeeding with your boobs out. What are you doing? Why do you have to do that? And a lot of family, younger siblings, that's gross. So we want to make sure that we're explaining to them how they can talk to their family and friends so that they can understand how important this is to them. And find solutions for her. Maybe when that particular family's around, she has some pumped milk she gives, or she's able to cover up enough for everybody to be comfortable in the room, and she doesn't feel like she has to go hide in the bedroom. So I love this cartoon, and I use this a lot because I see this happening. We're at a shopping center, we've got the big, Victoria's Secret ad, but a mom can't sit on a bench and breastfeed. So that's a good comic for me. So others want to feed. I hear this a lot. The only way I can bond with this baby is I have to feed them. So dad wants to be involved in feeding his baby. And I hear this a lot from my community is mom tells the daughter, if you breastfeed, I can't babysit, which means she doesn't want to hold and caretake of her infant. And I find that really sad because that's what all infants need. And then the other is I can't bond with the baby if you have him all the time. So we want to be able to teach our moms how they can teach dads and other family members to bond through things like skin to skin, not always changing diapers, but holding, snuggling, doing different things that actually creates that bond. And I always tell them in my class, I always tell my dads, you should do skin to skin 15 minutes a day for 6 weeks. And you and your baby will have the greatest bond. And I've actually seen a few families do this, and dad and baby, they rock. They are just the best friends. And dad can meet the baby's needs. And that's, I think, what dads are afraid of. So we really want to help give them ideas so that other people can feel comfort. And maybe telling grandma, if I breastfeed, I just pump the milk. It's just like if you went to the cupboard for formula, then you go to the refrigerator or freezer for breast milk. Too busy. So I think all of us as moms have felt at one point or another just too busy to fit everything in. I hear a lot. I've not been home all week. I haven't been able to breastfeed but once a day. I've had a ton of appointments, and I can't just whip it out everywhere and breastfeed because people really just don't think that they can, if they're waiting at the doctor's office, sit down, breastfeed. It's, one, it's the law, and two, we want to make sure that those moms understand that it's okay. Really hard in the first few weeks trying to learn to breastfeed when we have to be covered up or discreet. We want to make sure that they know to try to be home as much as they can. Other kids can be really hard. If you have a newborn, a 2-year-old and a 4-year-old, it's hard to just sit down and take a few minutes, but talking to her about ways she can help the siblings find downtime. So I need to breastfeed. What can they do now that's going to keep them entertained while I sit and feed? Maybe it's a movie time or cartoon time. Maybe it's sitting on the floor breastfeeding while you all play blocks together. I have a lot of kids who do snack time together. I teach the mom to build snack boxes and put safe snacks that the 2- and 4-year-old, when it's snack time, go get a snack, get one for mom, and come back and we're all going to eat together. And really try working on doing some togetherness and help them work through it. I do get a lot of, I feel like all I do is breastfeed, breastfeed, breastfeed. So really important to make sure that when we're doing this, that we're trying to help her problem solve because she, one, just got a baby and isn't thinking about ways to get around it. But the easiest thing she can remove from her life, which is breastfeeding. So breast refusal. So if they start giving bottles, or maybe they got a bottle in the hospital, now the baby refuses the breast, we definitely want to get them referred for some latch help as soon as possible. But you can teach her to do things like skin to skin, kind of pull together till she gets that help to start initiating that baby back at breast. Baby won't stay latched more than a few minutes. Again, we need some latch help here, but we need to make sure that even if the baby does a couple minutes each side and back and forth, we're still breastfeeding. Training, just like Erin said, learning to ride a bike, it takes training and practice for this baby to learn how to breastfeed. Baby has trouble latching on because of flat nipples. We need to refer again, but we can do things like, again, teach her that we want to make sure that we're bottle feeding correctly, correct amounts and not overfeeding, that she's able to do skin to skin and kind of let the baby hang out in the kitchen until he's ready to eat. Things like that can be really helpful. And I love this cartoon because you can just picture someone coming up and going, well, if you just relax, they sense everything. You know, you just need to relax and the baby will be fine. Sometimes it's not that easy. Lactation complications. So most of these, you're probably going to refer, but as Erin said in the first, complications from delivery. So if I jump in a conversation right to lactation with this mom and I don't ask how her delivery went, I will probably miss out on a lot of important information, like she labored for 12 hours but then had to have an emergency C-section. So I need to know that she's going to need more TLCing and walking through because she's tired, she's not been sleeping, maybe there was a complication and baby stayed in the NICU. A C-section may cause a delay in her milk coming in. Sometimes medical history we need to find out so we can get them referred. And again, breast trauma and surgery. So all of those are probably going to be referrals, but you as the peer can really talk to them and explain that there's a lot of training and practice and some intervention that may need to happen, but they can get through it with the right direction. So I like the saying, because breastfeeding is not easy, so I'm not telling you it's going to be easy, but I am telling you it's going to be worth it. And a lot of moms who I've worked with are very glad in the end that we hung in there, we worked hard for 2 or 3 weeks, and that baby's breastfeeding. So one big thing I find is because a lot of people, oh, the baby won't breastfeed, they crack open a bottle of formula. That's the easy fix. But what we need to, does she even know she has other options, like pumping and storing milk and feeding that way? Maybe we won't ever get that baby latched, but most WICs provide that pump so that mom can be able to store and give breast milk for that baby. Also, we need to explain to her about the cost of formula. So as a peer, the guidance that we need to do, one, we need to be very positive and praise and reassure for everything she's already done. We need to make sure that she understands that she is doing a great job. Because even if she stopped right there, she still needs to know what a good job she did. I do like, and I use this a lot, if a mom's close to 6 months and she's talking about formula, I do try to encourage her that, it's only a little bit of time before you can start giving foods. We can start working toward, breastfeeding with complementary foods. And sometimes that is enough for them to go, okay, I can hang out for another few weeks. I can do this. Because we don't want them to start foods early, but we definitely don't want them to start going to formula. So information that you can give her, so we try to keep her exclusive. One is the food package difference. It really is huge. And explaining the foods that she's going to get the difference can really, if it's a household, that may make or break their budget. So explaining, let's figure out how to, problem solve through some of this and keep you guys exclusive. So one big thing I like to teach moms is cost of formula. And I laugh when I teach this class and I say, do y'all know when you first got on WIC, we told you this was supplemental and that you were going to have to buy formula if you chose to formula feed. And it's, around $50 a month that you'll probably have to spend. And they're like, oh, wait a minute. So one question I ask them is, can you afford to formula feed? Do you have that extra $500 to be a formula feeding mom? Because you still have to buy diapers, you still have to buy all this other stuff. So can you afford that? If she continues to breastfeed exclusively past 6 months, what we need to let her know is that she's going to get foods for a whole year, along with the baby getting foods, and she's giving breast milk. And so it's important to understand that she's got so much more coming if she continues. If she were to be a partially breastfeeding mom outside of the food package, she still gets breastfeeding education, support, and nutrition help through the educators and peer counselors. And, as we know, if they need to be breastfeeding, in order to have access to the peer counselors. So if you have a really good relationship, sometimes you can throw that string in there and say, if you want to keep talking to me, we got to keep you breastfeeding. So this is a big thing that we go off of from our classes we teach, and it's a goal. We always ask the mom at the end of the class, what is her goal? What is her plan to breastfeed? Nothing grandiose, 3-5 years. What we're looking at is what does she think right now would be her realistic goal that she would like to breastfeed? So that when we go to talk to that mom and she starts struggling, we can go back and say, okay, remember in the beginning when things were not going, in your right mind, you weren't tired, sleep deprived, busy, you really wanted to make sure your baby had 6 months of breast milk. Okay, so you're at 4 months and you're talking about starting formula. Well, what can we do to keep you to get to your goal? That was something you really felt strongly about, and let's talk about options that may work for you. What can you do? And really making sure that whatever goal you set, I always like to end with, so does that sound like something that will work for you and the baby? Can you get it 2 more months, do you think? And if not, let's tweak it a little to make sure that works for you. So I use the goal a lot when I talk to moms. So we want to remind her about the benefits again. So when we're talking to them, remind them about the food packages they get, the nutritional education, breastfeeding help, and text, like our texting program and other peer programs, and then access to pumps. Most people don't realize the cost of a good quality breast pump is usually starting around $45, and electric pumps in our town rent for $60 a month. People go, oh, wait, okay. So it's an incentive that they don't realize they're on the program. And I come across a few people who say, well, I'm breastfeeding, I don't need to be on WIC. Like we're the formula program still. And I remind them about all the things that a breastfeeding mom can get from our program. So what if she still wants to get formula? How do we continue to support her? So a couple things we need to look at. She's never tried formula before. So we need to make sure she understands there's risks the baby won't tolerate formula. We need to make sure she understands that maintaining her supply, if she gives formula, it's going to cause problems with her supply. She needs to buy her first can and try it before we as WIC can issue that formula to her. Baby has to be over 1 month to get formula from WIC and still breastfeeding. And once you begin giving that formula, it will affect your milk supply and cause your milk to go down. So it will definitely decrease. So she's going to use formula. How can we keep her breastfeeding even if it's only partial? So we have to support her choice. So we've given her all the options. She says, I still want formula. Okay. We need to praise for what she's done and what she will be doing. Make sure she understands that even if she's only feeding once a day, that's still a benefit to her baby. Make sure she understands what happens to her supply, that it is going to go away, so she may not reach her 6-month goal. Encourage her to keep breastfeeding because every little drop counts. So we want to remind her, even if it's just once a day, it's still a value. So we've got a mom who's already partially breastfeeding by the time we talk to her, so she's already giving formula. We also need to make sure she knows to talk to her educator to calculate what she needs based on what she's giving, instead of what she qualifies for, to keep her getting food benefits. So she may only need 1 can. Well, WIC can still do that, still keep her breastfeeding, still keep her getting food benefits. We again have to remind her the more formula she gives, the lower her supply will be. There are some risks for abrupt weaning that I like moms to know about. So I understand that you want to give formula, but we really do like to see moms wean slowly to avoid clogged milk ducts and mastitis for herself, but also to allow baby time to adjust to formula and make sure that the baby can tolerate it. I've seen numerous moms switch to formula, and then all of a sudden they're on all the specialty formulas. Well, that's a lot more money that they're going to be buying. So we have to make sure they understand the baby's not going to just transition quickly and may not tolerate it. Abrupt weaning can cause hormone imbalances that can affect the mom. Baby needs time to shift gears, so continue cuddling, holding, skin to skin to make the transition smoother for her and her baby. And that when she bottle feeds, she really should continue to hold the baby just as she did with breastfeeding. So reinforce if they choose formula. They probably struggled with breastfeeding to some extent before they chose to go formula, but we need to praise her and let her know she did a wonderful job. She's a great mom for really thinking about the needs of her and her baby and trying to hang in there an extra week or whatever we got her to do. Encourage her to talk to a lactation consultant the next pregnancy if she's planning one or not planning. But what I find is I get moms who have struggled. They come talk to me, spend about 30 minutes. We talk about the last experience, and we figure out ways to help keep her from having the same experience. So it's kind of nice to have a little education ahead of time before you have that next baby and can help prevent some of those problems. So basically we're planting seeds for greater success for the next breastfeeding experience. I like this cartoon. I had to retype it because you couldn't read it, but no matter how I try, I can't figure out how these 2 cans of formula will help me breastfeed. So it's really important to understand that they need to know that formula doesn't help them breastfeed, like our new supplemental formula for breastfeeding moms on the market. Marketing, marketing, marketing. And I wanted to say that a peer counselor's gift to every mom is the moments that make that mom memories. So thank you for continuing to do awesome, powerful, kind women that share your gifts. So thank you. And let's see, I'm going to introduce Elena and Maria, right? Okay.
Hello everyone, my name is Maria, so we're just going to do a presentation on how to support a breastfeeding mom when those in her life do not. So first thing is, what is our role as a peer counselor? So our role is to educate, support, and empower. So educate is the number one thing. When a mom is educated on breastfeeding, her success rate with breastfeeding is higher and they will do it for longer. Supporting, so not pushing, just letting them know that you're here for them. I get, as a WIC educator, I would get a lot of moms telling us that they felt that they were being pushed to breastfeed. So just letting them know that you are there to support them on whatever they decide to do and empower them. Also let them know that you are available 24/7. I think when mom knows that they're more likely to contact you. And let them know that there is no dumb question. I had a dad call me last week asking if mom can have ice cream, so I think that was pretty cool, and I called him right back, and it was a 10-minute conversation with Dad about breastfeeding, so that was interesting. Education during pregnancy. So that is find out who is the support system, if any at all. Sometimes it might just be us that we're the only support system that they might have. So, yeah. So who are the support systems? So find out who supports them. It might be mom, it might be dad, it might just be WIC. We might be the only support system that they might have. And find out why they are motivated to breastfeed. When asking this question, I would get a lot of blanks from a lot of moms, and sometimes they would only answer yes just because they think that's what we want to hear. So just get into the why they want to breastfeed. What does she know about breastfeeding? What has she heard about breastfeeding? Sometimes there are many myths out there, and they might just believe them. And one that I hear a lot is a lot of moms, they believe that breastfeeding is only good for 3 months. So, and then a lot of grandmas believe this. So just find out what she knows about breastfeeding, and link moms with other breastfeeding education resources, which WIC is great. We have tons of breastfeeding resources, such as the Nurse Family Partnership and the Latch. And give the correct information and guidance once you know what they know about breastfeeding. And here are a few websites that you can educate mom on, and just refer them to. And find out who is the most influential people. So usually it's moms and grandmas who are the most influential in mom's life when breastfeeding. And encourage mom to bring moms, bring dads, bring grandmas, even their other children to the breastfeeding classes. Give them your phone number as well, like that dad who had my number. Just encourage them to contact you. That doesn't always have to be mom, just encouraging dad and grandmas to to contact you as well. Provide mom with resources and information necessary to educate and support them and support her team at home. So we have tons of resources that are focused on dad or for grandmas, just giving those handouts to them, just making those available to them. And empowering mom with knowledge and understanding that she is making the best decision for her and her baby. Just whatever she decides to do, whether it be exclusively breastfeeding or partial breastfeeding, just let them know she is mom. She knows she will be doing what's best for her baby. So just always praise mom for what she is doing. And I'll hand it off to Elena now. So I have actually a story about, it's a mom who had no support with breastfeeding at all. The only support she had was WIC. And it was so bad at home that she actually had to breastfeed in the tub. So when dad was working, she would nurse at home, but as soon as dad got home, baby would get hungry. She would go into the bathroom and she would just nurse in the tub. One day she came in with grandma, and she had not told grandma that she was doing this at home, and just talking with her, she told grandma, and I think just getting her the support in that appointment, just getting the support from grandma there, it made a big difference. So I think just always getting into depth of what who their support people are great. So that's me.
All right, hi, my name is Elena. I'm going to do the second half of it. So on the slide, we just have some breastfeeding support materials. I mean, grandma and dads are the #1 influence in a breastfeeding mom's life. And so I often find that dads are super visual learners, so I usually use the Lego handout. And then the breastfeeding benefits, I don't know if you guys all have access to that in your office, but it's A to Z, front and back of all the breastfeeding benefits. And then, of course, just like we talked about earlier about how family and friends can help with breastfeeding, that handout can help with, bath time and skin to skin and diapers and laundry and bottle washing if mom is pumping. So any of those breastfeeding support materials that we can give to mom and mom to take home to grandma or dad. So after delivery is definitely the most important time. Education is important, but if we're able to catch moms in those first couple of days, how much more successful is that mom going to be? So initiate communication with mom shortly after delivery to make sure that she could, and make sure you're continuing education in those first few days. Help correct any misinformation that she could be receiving from home. So sometimes there's just so many myths, especially in the Hispanic culture, about engorgement, colostrum, not making enough milk, colostrum's not milk, anything like that. So just making sure that the mom has the correct education. With that, assess any issues and refer to appropriate programs if needed. So always making sure that we're referring to IBCLCs, even dietitians in our office, so that the mom knows that not only us are there for her 24/7, but then she has dietitians and IBCLCs as well. If mom mentions lack of support, refer to a Latch handout, which we'll go over. If mom's not feeling like she's getting any positive feedback, then we'll use the Latch handout. You guys have access to that on the right-hand side where it says the Latch handout, lack of family, friend support for breastfeeding. Definitely open that up. But the couple that we found would be the most helpful. And these responses are mainly so that you can empower your mom to say this one sentence and then kind of end the conversation there. Because oftentimes, you don't want to, the mom doesn't want to start an argument with her grandma, with her baby's dad, with mother-in-law, anybody. So she just wants to have kind of a one-liner to avoid criticism. So having support means so much to me. This is a sentence that clearly just tells the support person in that mom's life that supports all she needs. She doesn't want an opinion, maybe. She just really needs that support. I think we're losing sight of our goal here, which is the baby's well-being. Let's back up a little bit. So this could help everyone remember that everyone really only wants what's best in the baby's life, and maybe for other reasons they've gotten off topic. So sometimes it can be like mother-in-law never could breastfeed, so maybe she doesn't want this person to breastfeed either. So just losing sight of the goal, which the goal should be baby, breastfeeding, and a healthy baby. So backing up a little bit and kind of getting back on focus. This topic has been argued and debated for years. Let's not fall into that trap. So mom could use, again, this one line to kind of agree to disagree and then just move on. The mom's going to do what she thinks is best for her and her baby, and then just let's end it there so that there's not any more hurt feelings. And then another one is always giving mom resources in the community where she can reach out for help. And if your WIC office doesn't have like a breastfeeding resource guide, I think this is something that's super beneficial so that a mom can see not only is it WIC, but there's a Latch League, maybe there's other stores or support people in your area. Hospitals have baby weigh-in programs. A hospital has like support groups that are free, and so mom can utilize it. It's not just WIC that's encouraging her to breastfeed. It's definitely more than just us. Maybe she's more open to talk to her hospital or her doctor's office there about breastfeeding. And since we're definitely early on time, so this is a refresher course for peer counselors. We definitely just kind of wanted to maybe open it up a little bit and see if any of you guys had something that you found super helpful to talking to a dad that was completely against breastfeeding or a grandma that was completely against breastfeeding. I know I've empowered several moms just using that Lego handout and handouts about colostrum to empower a mom to tell a dad, I am doing what's best. I do know what I'm doing. I do want what's best for my baby, and then have support to back it up. So if any of you want to unmute your button and tell us anything that you have found to be helpful or handouts you found to be helpful, you can go ahead. Yeah, so there was a question on the side about the A to Z breastfeeding benefits. That's a childbirth graphics handout. So I think if you go on Childbirth Graphics website, you can order that. Does anyone have any input on possibly how family and friends can help with breastfeeding? I know that we typically go to like changing diapers and laundry and skin to skin, but is there any other things that you guys have often told dads that maybe they could help with breastfeeding to help a mom so that they do feel included? Some dads don't want to do skin to skin. Some dads don't want to be always on diaper duty. Okay, so we're opening up the chat box. For sitting in his lap and nurse your baby together. So there was an awesome picture on a slideshow before ours with mom, dad, and baby all doing skin to skin in bed. So that's definitely awesome. Back time. Thanks for helping us brainstorm.
Also, while people are typing, the files are available for you to download. So I know in this particular presentation, they had a great slide with a lot of web links. So obviously, you didn't need to write those all down. So they're available on the right-hand side of the screen, and you're able to download those and print them off. Correct, Linda? Right. So, but if you have any technical difficulties with that, let me know, and I can just email them all out as well.
Okay, so rocking baby, bathing, taking baby for walks, giving mom a break, reading baby books. So just empowering dad that there's definitely other things they can do. I think feeding is always the number one thing everyone wants to do. So there's definitely lots of stuff to do to care for a baby, as we all know. Talk to them about their concerns of being a dad and affirm those feelings. Definitely, I mean, dads dads are number one cheerleader, but then they also are going to have their own concerns as far as breastfeeding, baby care, all of those. So making sure, dad has correct information, but also that you're acknowledging dad's feelings, definitely. Making healthy snacks for mom, bringing a glass of water, definitely caring for other kids if there's other kids in the house. So Valerie, thanks for your input. You put share with dads that I know that they want to be helpful and that men enjoy especially that they're being helpful. So sharing that supporting breastfeeding and caring for mom while she's breastfeeding, that's actually the most helpful, meaningful thing that they can be doing. Definitely. I mean, just giving the mom 10 minutes to take a quiet shower, those are things that dad can do. And definitely support dad in doing those things too. Sometimes you have to talk to mom about all of this stuff too. Sometimes it takes a while for dad to even come into WIC. They don't think WIC is for men. They don't want to come to breastfeeding classes. So empowering mom to bring those people to breastfeeding class so you can talk about all of this stuff as well.
Also, a thought is to remind the caregiver support system that, within 6 months, baby will be starting on solids, so they can help with the solid feeding while mom does the breastfeeding. So, although it's a ways off, early on, just share with them. That can be their thing. One less thing for mom to have to do, right? Well, thanks for all the feedback and comments. That's awesome. I think we got a lot of good input from you all, so we really appreciate that. And we are slightly early, which is pretty good. We missed that video, so kind of shortened the time here, but I think that's okay. Everybody's probably pretty busy. If anybody has any questions on any of the presentations, we could open that up right now for some questions for you to type in. And so feel free to do that. We might do that for about 5 minutes, and if we're done then, we'll wrap up. So feel free to type in any questions on mine, Sonia's, or Elena and Maria's presentations if you had questions. They are embedded in the PowerPoint, but everybody should have access to the PowerPoint, which is on WIC Works, so I can send that link out. And that was the question on, is the video link embedded in the PowerPoint? Okay, so Valerie's asking, not related directly, but do any of you use resources for laid-back nursing? Hand out something different moms can take home.
Noodle Soup, I think, just came out with a handout for laid-back nursing. And I think I ordered it, but I don't think I've received it yet. So you might look in Noodle Soup.
I wonder if Sonia is open to being a guest presenter. What do you think, Sonia, for El Paso?
Sure.
I would gladly come do that. Sonia says yes. I thought cabbage leaves were used to dry up moms. So, Kara, they're just used temporarily as another cold device, so such as frozen peas or ice packs. So in between feedings, you can do cold, and before feeding, it'd be better to do warm, such as like a wet diaper that's been soaked in hot water that you can put within your bra, or the warm shower. So cabbage leaves, when you put them on the breast or within your bra, they wilt really quickly. And you're not using them long term, you're using them temporarily. So you may see mixed opinions about that, but they're not long term, and like I said, they wilt pretty quickly.
Kelly, this is Sonia. So just email me. We'll set up a date. I'll come do the presentation, but you're more than welcome to do it yourself. I know you and Amber would do it justice. So.
All right, I'm not seeing any more questions being typed. Of course, feel free to email me, Erin, ERIN.Johnson, JOHNSON, at state.co.us. You should all have my email from the communications I've been sending out on the webinar. And if you have a question for Sonia or Elena or Maria, I can forward that on to them as well. Oh, it looks like Shasta has one question coming in. And for those of you who have things to do, feel free to sign off unless you want to stay and see what Shasta's typing. And Valerie. Oh, the Adobe presentations that we're recording today, we'll send a link after Linda gets it all together. And I'm assuming some peer counselors couldn't attend this, so please share with any of your colleagues. And I want to thank everybody again for your time, and sorry for the snafus in the beginning. We're all learning here, so now we've learned what not to do next time, correct? Have a great day, and keep doing all the good work you guys are doing. We appreciate it. You're supporting our moms and our communities. Thanks.